So I have two questions for you to make it relevant for you to continue watching this video. The first question is, are you a woman? And the second question is, if you're not, do you have loved ones who are women? If you answered yes to any of these questions, you would benefit from watching this video because there's one problem that all women will have to face. The woman can either be you or the woman whom you love in your life. And again, I repeat, all women will have to face this problem. And that one problem is menopause. I spent the last week on a roller coaster ride while in vacation in Asia and arriving home. If you have time, go ahead and check out all the videos that I made in Japan, in South Korea, and more to come in my previous videos. So I decided I was finally ready to move on in career. I've just been so exhausted working in the hospital as a bedside nurse and dealing with the incredibly sick, the extremely ill, and those who are nearly dying. I just felt I needed a brighter side to life, to help people who can actually help themselves. It's been 13 years, so I thought, why don't I try women's health? I'm a woman myself, and what better way to help those in the future than to speak from a first person's perspective? I spent the last week reviewing notes from my nurse practitioner program, reading online articles, and studying the objectives of the company that I want to interview for. And trust me, the information was alarming enough for me to want to share it with you. I also reflected, what would I be doing in the office as a nurse practitioner in women's health? Basically, I would be helping you or the person in the office make informed decisions. So what better way to help my patients in the office and also you as a viewer on YouTube than to explain my findings? So here I go. So what is the true meaning of menopause? Menopause is when you've stopped, completely halted your menstrual cycle, aka period, for exactly 1 year. Therefore, if you have any signs of bleeding within 1 year's frame, it does not mean that you're in menopause. However, you may be experiencing symptoms of perimenopause. It's the period right before you go into menopause. So at this time, your ovaries, the organ that makes the egg, shoots it out into the body and gives you signals for pregnancy. Well, this organ deteriorates over time and it begins to not make hormones for your body like it once did. At this time, your hormones will begin to fluctuate. They will go into disorder and chaos. You may begin to bleed irregularly. On some days, you'll have more bleeding. On some days, you'll have less bleeding. And you may have breaks that are longer in between each cycle. So you won't go into menopause until you've completely stopped bleeding for exactly 1 year. So the two most common hormones affected during menopause is estrogen and testosterone. They drastically decline. Now, the drastic decline in estrogen is a terrible, terrible symptom for women. The body will respond immediately as soon as it feels a difference or a decline, a slight decline in estrogen. The first most common symptom that women complain of is hot flashes. So what does hot flashes feel like? It is a sudden, intense, warming feeling that can take over your face, your neck, and your chest area, which can result in excessive sweating. Not only does losing your estrogen cause hot flashes, but it causes a plethora of symptoms. And it only gets worse as your estrogen declines over consecutive years. Now, these symptoms that come on after hot flashes are vaginal dryness, which may impair your sexual activity and give you pain during sex, mood swings, weight gain, especially around the stomach area. Now, if you want to check out my other video on abdominal obesity and what it can cause to your body, you can go ahead and click the link right here. Dry skin, the urge or the need or desire to pee more often, more urinary tract infections, because the microbiome in your urogenital area, it changes after menopause. The estrogen levels change the microbiome, which affects the natural defense that you once had. Uncontrollable peeing, where you can no longer hold the urine and maybe a little bit at a time will come out while you're rushing to the bathroom or while you're laughing. Sexual dysfunction because of loss of libido caused by decreased estrogen. Loss of bone strength, also known as osteoporosis. And lastly, heart disease. Again, it's exacerbated by the increase in abdominal fats in your stomach, which can give you high cholesterol, high blood pressure, and high blood sugar, which puts you at risk for getting diabetes. So these are the symptoms that I, myself as a woman, has to look forward to in the future. Once my estrogen levels have failed me, awful, isn't it? And all because of the loss of one hormone, estrogen. So through my research, what have I learned to teach women to do for themselves in order to combat these symptoms? So the first intervention is education. I'm taught to educate the patients to stay away from foods that cause hot flashes, such as spicy foods, chocolates, and other foods. Stay away from alcohol that cause hot flashes. Maybe some alcohols do and others don't. So it's important to note these items down. Stay away from hot showers or hot baths because it's been known to elicit symptoms of hot flashes. Wear loose-fitting clothes because you never know when the hot flash is going to just strike you from nowhere and you end up needing to remove the loose piece of clothing. Lastly, to control the room temperature so that the humidity is low and the temperature in the room always stays cool. But given the seasons and the changes in our everyday lives, it's really difficult to keep up with all of these educational instructions. So, depending on the time and day, the symptoms will come and go, which probably explains why menopausal women have mood swings. The second intervention that I want to introduce, and the most debatable topic, is menopausal hormonal therapy, MHT. Menopausal hormonal therapy depends on whether a woman has a uterus. If a woman has had a hysterectomy, the type of hormone that the woman will need would just be estrogen. However, if you still have your uterus intact, usually the hormonal therapy that the physician would recommend is progesterone and estrogen therapy. It would need to be the combination. Now, this combination therapy can come in a pill form, while topical estrogen therapy, which can be applied directly to the vagina to treat vaginal dryness and to improve sexual dysfunction, is also another option. So oral hormonal therapy can be given to women to slow down the development of symptoms from menopause, or the vaginal estrogen creams can be given to improve vaginal dryness. So according to research, menopausal hormonal therapy can relieve hot flashes, night sweats, vaginal dryness, and painful intercourse. It can also lower the risk of hip and spine fractures, because then again, menopause can cause osteoporosis, weakened bones. Unfortunately, once you stop estrogen therapy, the estrogen will go back to baseline and you will begin to experience menopausal symptoms again. In other words, it's only delaying the symptom that you are bound to face. However, estrogen therapy does come with risks. Because estrogen is being replaced in the body back to the baseline of what a woman has had prior to menopause, it can cause vaginal bleeding, as if you were on your period again or menstrual cycle again. And a lot of the times, if a menopausal woman, a woman who has not had her period for a long period of time, begins to bleed, the bleeding after menopause can be a symptom of uterine cancer. So if you're taking hormonal therapy, it's going to mask the signs and symptoms of uterine cancer. So it would be very hard to detect the initial signs of uterine cancer if you're on hormonal therapy and you're in menopause. Research has also shown that being on hormonal therapy can cause you to have more urinary incontinence, which again is uncontrolled urination. It increases the risk of dementia for those greater than 65 years old. It increases one's risk for heart attacks, strokes, and blood clots. Now, blood clots is a major issue. Even women who are taking hormonal therapy to control pregnancy, aka birth control pills, we are taught that the number one risk factor is blood clots. For example, if you're interested in emergency contraceptives, such as birth control pills, we as a provider, we're told not to give someone emergency contraceptives with hormonal therapy, such as estrogen, if you have a history of blood clots in your family, a genetic mutation that can cause blood clots, migraines with aura, high blood pressure, history of breast cancer, if you've had surgery that forces you to lay down more than often, meaning the blood flow in your body cannot move, which adds to your risk of getting blood clots. There are so many precautions that surround blood clotting. Estrogen therapy can also increase one's risk for getting endometrial cancer, breast cancer, and increase the breast density, which may affect a mammogram reading in the future, which puts a woman at an increased risk for getting breast cancer if the breast tumor cannot be detected. So the future looks really grim for us women. So the question is, should we just deal with the downfalls and the symptoms of menopause that affects our emotional well-being, our bone health, heart health, and everyday lives from the debilitating symptoms like hot flashes, which eventually goes away in the future, but you have to deal with it for several years on hand? Or do we make the decision to take a pill like estrogen to alleviate the daily debilitating symptoms of menopause and slow the progression of diseases like osteoporosis or bone loss? I guess that's your choice and my choice to make. According to the American College of Gynecological and Obstetrics, they say the length of therapy should be dictated by clinical response, meaning how well the woman feels while on therapy and while experiencing symptoms of menopause, and it should be kept as short as possible. So they don't recommend for you to take estrogen therapy long term. It is only recommended to treat the symptoms that you currently have and if it's affecting your everyday life. So only decide to use estrogen therapy if it's temporary. Well, on the upside, there have been new advancements in technology that I recently came across when I landed my previous interview with a women's health clinic. There is a new procedure by ThermiVa. This procedure tightens the vaginal area by inducing collagen production. This procedure is non-invasive, meaning they don't cut into your skin, and it doesn't require any anesthesia, meaning you're wide awake during the procedure. The wand from the machine applies radio frequency to the vaginal area like a warm massage. The result of the procedure is a tightened vagina that again can become loosened, inflamed, dry, and painful due to low levels of estrogen during menopause. It can reduce the uncontrolled urination from menopause. It can improve the sensitivity of the vagina due to vaginal dryness from menopause, making sex more enjoyable because of the improved lubrication in the vagina. Again, this procedure requires no anesthesia and is comfortable like a warm massage. The results can be immediate or after the first few treatments. There is no downtime to the procedure and you can return to your normal lifestyle the day of the procedure, meaning you can go back to exercising, moving about your daily life, and even have sex the same day. Okay guys, so now that I've discussed 3 options that you can do in your life when you're going through menopause, such as the lifestyle modifications, prescription pill treatments, aka estrogen therapy, and advancement in technology, which option do you think you're going to choose when you're going through menopause? Or maybe you're already experiencing the early symptoms of menopause and you're trying to look for a solution. Which one will you choose? My question to you is, have you tried any of these interventions? If so, comment below and let me know your thoughts. That way I can help my future patients make better informed decisions. Well, I hope you enjoyed my presentation. Please comment below, like, and subscribe. Bye!